All right, welcome everyone for our panel discussion today regarding the ARC's Dental for All program. So my name is Carrie Major. I am Director of Special Projects at the ARC US. I am joined today by 3 chapters of the ARC who I'll introduce in just a minute. So all 3 of these chapters have implemented the Dental for All program and are here today to share their insights into how they got their program started in their community. So a little background about the Dental for All program and purpose behind it before we begin. So people with disabilities are at a much higher rate of having poor oral health than the general public. And it's been reported that 90% of people with disabilities have some form of gum disease. So poor oral health doesn't just affect your mouth. It's been connected to several other secondary health issues, such as cardiovascular disease, diabetes, respiratory infections, Alzheimer's. Tooth pain and decay can also affect people's behaviors and their eating habits as well. So it's really important to make sure to maintain good oral health for a variety of reasons. So as you probably know, many individuals with and without disabilities have a big fear of going to the dentist. And so this fear can be heightened for a lot of people with disabilities due to their increased sensitivity to sensory stimuli in their environment and other barriers such as communication challenges, past personal experience with the dentist, or physical environmental barriers that are preventing them from receiving quality care. So we think, though, with knowledge and practice, we want to try to remove the fear of going to the dentist in hopes that people with disabilities will start receiving those routine cleanings and checkups that can oftentimes, prevent plaque and buildup and smaller issues from turning into larger complications. So that's why we created the Dental for All program. It's a partnership between a local chapter of the ARC and a dental clinic in that area. And they partner together to host a dental office open house. So at the open house, we invite families who have a loved one with a disability to come to the dental clinic and meet with the dentist in their area. So during events, families are given a tour of the entire dental office, starting from the reception desk to the dental chair and the tools that are used. We also walk participants through what's entailed in a routine cleaning in the hopes that this will reduce participants' fears while also providing that necessary hands-on training and education for dental providers about the needs of our population and tips for better communication between the dentist and the patient with a disability. So I want to take a second now to introduce our 3 chapters that'll be on our panel for today. First, we have Sherry Landis, Executive Director from the ARC of Pennsylvania. Kelly Monroe, who is the Executive Director of the ARC of Louisiana. Donna Kutzer, President CEO of the ARC of San Antonio. So thanks from the support for the CareQuest Institute from Oral Health. They've all implemented the Dental for All program in their communities last year and are here today to share a little bit of insights about what they've learned with you today. And we hope this information will help those of you who are interested in planning an event in your area. So without further ado, let's go ahead and get started. So first question for our panel today, these events wouldn't be possible without a partnering dental office. They are kind of the main draw of it. We need them. So what strategies did you guys use when reaching out to dental professionals in your area to get them to see the benefit of this type of event and agree to host a dental office open house with you? So Sherry, do you want to go ahead and start us off?
Sure. Thanks, Carrie. So we were really fortunate. The first dental office that we contacted actually has a partnership with a provider of home and community-based services in north of Philadelphia. So they were very eager to have an open house. So that was the easy one. So the other one that we wanted to make sure that we touch base in a rural area of Pennsylvania. So it took some time, took some, calling our chapters to see if they had relationships with dentists. But where we landed is we work with the Pennsylvania Coalition on Oral Health, and they were able to put us in contact with a dentist up in northwest Pennsylvania, up near Erie. Actually, it's between Pittsburgh and Erie, very rural area, small town. And he provides Medicaid services. Actually, the healthcare system up there set him up with a private clinic. So, because to keep people out of the emergency rooms with dental issues. So that was a little bit more difficult and challenging, but once we identified him and made contact, he was more than happy to do it since this is a population that he already serves.
Awesome, thank you. Donna, do you have anything to add?
Yeah, I think here in San Antonio, we are kind of we are a sprawling city. So we did two locations. We had one on the far northwest side and one on the far northeast side. The dental school here at UTSA, the University of Texas at San Antonio, recently opened a special needs dental clinic. And we were a community partner with them in that opening, trying to help them learn more about the needs of the community and how to navigate the space and everything. So when we reached out to them, they were more than willing to host a clinic there for their students. So we were able to bring individuals with IDD over to the clinic. And one, it helped them introduce them to the clinic that's now available in San Antonio that wasn't here until February of last year. And two, it gave the students a great opportunity with some hands-on experience with individuals with IDD as they were in school. So we used the dental clinic, and then as many of you know, here in San Antonio, we're blessed to have Morgan's. And so we partnered with the multi-assistant center with Morgan's Wonderland and they have a dental clinic inside the center there. So we partnered with the center there to help expand. They just recently opened to expand to their audience what was available through that location.
Great. And Kelly, anything you want to add?
Sure. So I don't know if you guys are familiar, but Louisiana recently passed a bill to include dental services in their waivers for home and community-based services, but also for the ICFs. But prior to that, we participated 4 years in a work group gearing up to get this legislation going and getting dental services covered for people with disabilities. But in that work group, there were some professionals, a lot of family members, but there was also the Louisiana Dental Association, and I would say probably 4 or 5 dentists. Of those 4 or 5 dentists, I believe 2 of them had children who had disabilities. So of course they were all very, very supportive of this. And so when we reached out to the Dental Association, we were able to get a couple of dentists to allow us to come in while they were in operation during the day to have this done for people with disabilities. So it was really good.
Awesome. And I like how you each had a different angle there of how you reached out and recruited dentists in your area. So it's different creative ways to get them on board. So next question is, with planning any new event, oftentimes we run into a few bumps in the road. I know that reaching out to the dental professionals was probably one of the hardest parts and getting them on board, but what are some of the challenges that you all faced when planning your events, and how were you able to pivot to overcome some of those challenges? So Donna, you want to go ahead and start us off for this question?
As a local chapter, I think when we're a local chapter that provides a lot of services, we do have a day hab, plus we have 3 case management services. And so sometimes when you take on a project like this, it could be, oh, another thing to the list, right? Mm-hmm. So what I learned quickly was start small, work with one and get one settled and get one moving so you have a plan. But first and foremost, develop the plan. How do you want to do it? What do you want to do it? And once you start kind of developing your plan and working the plan, it starts to come to fruition. But start small and work with one dentist and make sure you've got one dentist on board who's interested and excited about serving individuals with IDD, and help them understand that it creates a win-win situation for them because they're trying to grow their business and they're trying to expand their business. And so if you say, I'm going to help you I'm going to bring new patients potentially to you that do not know you're here and do not know you exist. I think, and getting them on board that way is seeing how it benefits them, kind of helps overcome that bump or overcome that hurdle.
Yeah, and that's smart to always make sure you don't bite up too much to, that you can't chew it the first time. So you can start off with a smaller pilot and then expand throughout, the year goes. Awesome. Kelly, anything from you?
Yeah. So timing was an issue for us. We, of course, wanted to try to have this after hours or after school hours so that families would be able to bring after work, be able to bring them to these events. We did have a little bit of an issue with dentists wanting to stay late and maybe having their staff stay late, but it actually worked out better because they allowed us to come in during while it was being fully operated, and the participants were able to see people actually being worked on during that time, and so it actually worked out really well. Instead of families bringing them, we did have schools show up, a couple of classrooms show up, and did like they use it like a field trip, and that was great. We also had some provider agencies bring some of the day habilitation people to these events, and so it worked out really well. We had really good participation, so we thought it was going to be an issue, but it turned out not to be. So,
Great. Sherry, anything to add as well?
Yeah, I think the timing was a big factor for us in both locations. Not just with time of day, but it's the time of year. So it's still nice weather and kids have a lot of activities if they're bringing younger patients. For our Meadville, which is the one near Erie, we also had to factor in that a lot of people were going to drive a great distance to get there. In fact, one of the participants drove an hour and a half, so they showed up towards the end. So the timing issue is difficult. I mean, I think it's difficult when you're planning anything. We the place in north of Philadelphia at Wood Services that's supported through the University of Pennsylvania's dental school. Um, the timing issue there was really around activities, but we had it in the evening and it still worked out. We had a great turnout, but that's what anytime you plan anything, it doesn't matter what it is, a dental open house or anything. I think it's just trying to find that sweet spot in the day that gets everyone there. I really loved Kelly's example, though, of classrooms using it as a field trip, and I never thought of that. For if we do this again, it would be interesting to reach out to the schools in the area and maybe have something during the day. I love that idea.
Yeah, I do agree. And that partnership with schools is a great way to make those connections in the community, get them to keep coming back with new classes each year. So that is a great idea. All right, so our last question, we had a lot of success stories about families attending these events last year. Are you guys able to share any of those successes or provide any, tips about what you thought really helped to make your event such a success? Were you able to incorporate people with disabilities into any of your planning or implementation from these events?
yeah, I guess I can start.
Yeah.
We had at one of the locations that we did had this event. There was a person that one of the ARCs actually helped find a job at one of these dental offices. And so that was really good because she was able to kind of like give the tour. She was excited to be able to do it too. She gave the tour, kind of showed them some of the instruments, kind of let him play with the instruments a little bit in one of the rooms that was not being used. And so that was great. We did have one person who hadn't been to the dentist in over 10 years who made her appointment and has gone since we had the event. And I'm not going to say that she was completely, calm and ready for it, but she went through the entire process of getting her teeth cleaned for the very first time in a very long time. So we'll take it. That was success for us.
Yeah, and that's a huge first step into getting those, more routine visits to the dentist. That's awesome.
We had some success. Ours was in the evening as well. I think like Sherry's, and because they weren't being in use, the dental teams let them sit in the chairs, touch the tools, they could turn on the tools to hear the zzz, right? That kind of gets us a little nervous the minute they start. And I think that was really important because, right, they got to experience, here's what's going to happen when you sit in the chair. Here's what happens when you lean back. Here's where we start. Like they walked them through the process, and you could see people kind of start to calm down and relax a little. I think we all understand that feeling of not necessarily enjoying going to the dentist. But one of ours also had a board certified behavior analyst there to start to help the parents understand too, here's what may happen and here's how we address it. And here's how, and she works for the dental practice. And so she's there kind of all the time hands-on to help the families even navigate what happens, right? Because they're just as nervous, I think, as the individual sometimes when that individual sits in the chair. And I think what it showed us from a success perspective is how we can do things at a local level like this.
Mm-hmm.
Right? It doesn't have to be, and if you don't have a dental school, don't worry about a dental school, find a dentist and just have an experience. And I think it was really enjoyable for all. And I think our families were grateful. We got a lot of positive feedback in the surveys afterwards that we even offered this. And I think it goes back to the timing. They wish we'd offer it more frequently. And I don't think they realize behind the scenes how much work that takes. But I think it gave us the opportunity to go, how do we do it differently? And more importantly, how do we continue it in the community this year? What does that look like? Because we did our events in August and September of last year. So how do we do that now this year? And when do we do it? What's the right timing? So I'm grateful for the opportunity because it was a lot of fun for us all.
Mm-hmm.
Yeah, it was really interesting to see in the one family, the 5-year-old daughter had never been to a dentist. So, and in fact, the mom, when she first came in, said, "Oh, I come here for tooth extractions." So you already know that dental oral health care is not high on the list if that's her oral health of getting just teeth pulled, that's not the way it's really supposed to go. But they left and before they left, they made an appointment. So that was such a success. And then at the other location, there was a family whose son was struggling even just to go through the dental clinic. And by the end, the staff was amazing. And they have massage chairs. Like, don't we all want to go to a dentist with a massage chair? They actually had an appointment with another dentist that it doesn't go well, not the dentist's fault. It's just very difficult for both parties. They canceled that appointment and made an appointment at Woods. So, I mean, it was just so positive to see, the transformation. And actually, I'm not a good I'm a very anxious participant when it comes to going to the dentist, but it actually made me feel better too. I mean, it was such a positive experience, and I think the more that we have these, it's just going to keep getting better. I mean, obviously, oral health care is so important when you talk about overall health. So, yeah, looking forward to doing more.
Awesome. Well, thank you guys. That's, all the time we have today. I think these events are really important. I also have a huge fear of the dentist, so I see the value in just learning what's going on. And I have my dentist explain everything that he's doing to me step by step. So developing a relationship with those local dentists who can help make the experience as easy and painless as possible is really, really valuable. So thank you all for sharing your experiences and your knowledge with us today. If anyone watching this is interested in implementing a dental office open house in your area, the ARC has a toolkit that will walk you step by step through implementation. That can be found on the health page of the ARC's website, which is www.thearc.org/health. And you can find the toolkit and all resources there for that. So thank you again to our panel members, and I hope everyone has a good day. Thanks.
Thank you.